Okay. While I'm waiting for Adam to join, I'm going to introduce myself. My name is Sharon Jacoby, and I am a clinical application specialist for your
Am I live?
areas.
Ah, yes. Can you see me?
Yes.
Okay, I can't see myself. I'm on the phone now, so it's uncharted territory. Okay, are we good to go?
Yeah. Do you want to say a few words, or I can just dive in?
Yeah, no, we go ahead. I'll start off really because there'll be some people who weren't here last week. So just a quick intro to ABC and Alma, really. Just for those who don't know, because as well as existing clients, we've got some prospective and we've opened it out to therapists across, and I've even had messages from Albania and Canada, believe it or not, if they can join. And obviously we've welcomed everyone with open arms. So I just wanted to say hello to everybody, really. A quick line about ABC and Alma. We are the UK Alma partners. Alma Lasers, I'm sure if people are looking into us, they know a little bit of history about us. But Alma started in the 90s. It's a world-leading provider of energy-based solutions from surgical, medical aesthetics, as well as a beauty side. We're in over 80 countries with the largest R&D, marketing, and PR teams throughout a laser company. We've got some registered patents for all of a lot of our technology for the soprano, the harmony, the accent, and regards to our clinical studies. A lot of people have been asking us. Please do DM me, but we can be found in your Journal of Cosmetics Laser, Dermatology Surgery, British Journal of Dermatology, Laser in Surgery and Medicine, and others. So I just want to do a short intro because I know we're running late. So we'll pass you over to Sharon, but I am around for the end for questions and answers, and hopefully we'll catch up after. I'll leave it to you, Sharon.
Okay, great, thank you. Okay, so as I said, clinical application specialist for Alma Lasers, providing clinical support for all of Europe, Middle East and Africa, and also in charge of global training, meaning that any device that you buy from Alma or you use, we provide clinical support, information. There's a community, a forum, and this is all about the clinical support and training. So today, while you guys are still coming to the end of your lockdown, so you need to get ready for getting out there again, I'm going to talk to you about the Harmony XL Pro platform. So this is a huge platform of many applicators with many technologies. And I think Adam asked me to present this, and I think it was a great idea because a lot of people don't realize the capabilities that their Harmony device has. And it really is kind of a clinic all-in-one device. What I'm going to do is I'm going to go through some of the best-selling technologies, some of the best-selling handpieces. I'm going to talk clinically about how they work, which is always important with any laser or light or energy-based device. And then I'm going to talk to you about how to use it, what indications, and I think more importantly, at the end of towards the end of the presentation, I'm going to give you some really good clinical tips of how to combine different technologies, all from the same platform, for the ultimate treatment. I will be focusing mainly on skin rejuvenation. However, I will be also referring to pigmentations and vascular lesions. But the emphasis here is on skin rejuvenation. And any questions you have, I think the best way is to pop them in the chat box, and we will get to them at the end. We've left time for questions and answers, and I will try to answer all your questions at the end. So this is kind of our marketing banner, and I think it really sums it up in terms of flexibility and freedom. So having this Harmony platform really gives you just kind of endless opportunities and endless technologies in order to get the best results. So you are kind of the artist with your palette there, and it's up to you to create that masterpiece. So it does have 65 FDA cleared indications. We're not going to go through all of them, but we are definitely going to talk about the main indications. And if you look on this slide, you can see kind of a whole kind of plethora of indications that have all been cleared for the Harmony XL Pro. The popular ones, just to name a few, which I will be referring to throughout the presentation: acne, very popular, leg veins, skin resurfacing, a few more kind of rare indications such as venous lake or nevus of Ota, depending on the area of the world that you're dealing with. Stretch marks, so it really covers everything you would need in your aesthetic clinic. So these 6 major, I like to kind of divide it into 6 major categories: skin modeling and lifting, resurfacing, kind of similar, rejuvenation, toning, pigmentations, texture, pores. We'll talk about vascular lesions and how to tackle those. We'll talk about removing pigmented lesions, so age spots, sunspots, freckles. I won't go into tattoo removal today, but feel free to ask me about that at a later time. And again, hair removal, that was last week. And we'll touch on acne as well, a very, very popular indication. So it's clear, I'd like to just mention to you a very important fact that not everyone realizes. This is your Harmony XL Pro Special Edition on the right. There's been a evolution of Harmonies. So you may have the not special edition, but it's still special, and it may look slightly different. However, what I want to say to you is that the Harmony itself is not the technology. That is the screen, it is the cooling mechanism, it is the computer electronics. Every time you change an applicator on the side of your Harmony, you are changing technology. Your technology is in your handpiece, okay? And that's important to remember. So when I say technologies, I'm talking about lasers. I'm going to talk about IPLs, so intense pulse light. And there are some other handpieces that don't come into those categories, but are still very, very popular. Because I can't go through all of them today, I'm going to focus on the 4 laser handpieces that we have. The very, very kind of best-selling DiVL IPL handpiece. And I'm also going to talk a little bit, because we're talking about rejuvenation, lockdown, mask wearing. I'm going to talk about the near-infrared handpiece as well. So that's what we're going to focus on today. And then, like I said, I'm going to give you some tips for combinations, for combining all these technologies. So let's make a start. Bit of an overwhelming slide, but it's nice for me to kind of just see everything on one slide. What I've tried to do here is, and we're going to really drill down one by one, is just to name the different handpieces, whether it's a laser, an IPL, a lamp, its wavelength. It's chromophore, meaning what is it absorbed by in the skin? We're talking about laser skin interaction here. Pulse width, I'm not going to go into that too much today. What kind of effect do you get on the skin once you've lased this? Is it fractional or full spot? But like I said, this is a summary, and we're going to go one by one. So this graph, I'm not going to show many graphs, I promise, but this is an important graph, one that you guys, I'm sure, are very familiar with, and one that we always need to remember. And this is when we are looking at a particular wavelength and we put it on the skin, what's going to absorb it? What are we targeting? So for example, if we look at a laser in the visible wavelength, we are going to get absorption by melanin, this black line here, by hemoglobin, and by water, meaning it's a strong laser or light. If we fire a wavelength, say carbon dioxide laser, which is all the way down here at 10,600 nanometers, we only have absorbance by water. Okay, the melanin is not affected, the hemoglobin is not affected. And more kind of important for the Harmony, if we look, for example, at the Erbium YAG laser, again, you can see a very, very high absorbance in water, making this a fantastic ablative laser. But again, nothing by melanin, nothing by water, which is important if you're treating high skin types. If you're treating skin type 5, skin type 6, you want to know if there's a danger, if there's a competing chromophore in the skin. So that's just something to always be mindful of. So let's start with our laser modules. And these are ClearSkin PRO. I will talk about the difference between ClearSkin Original and ClearSkin PRO, very similar. We're going to talk about ClearLift, the best-selling Alma's applicator, Q-switch laser for rejuvenation. We'll talk about the Erbium YAG laser that I spoke about now for ablation, and the long pulse ND YAG 1064 laser, which is a very, very strong and effective laser for vascular lesions. Okay, so the ClearSkin PRO was introduced, I think about a year ago now, and it was an upgrade from the original ClearSkin. They are both erbium glass lasers, meaning that within the handpiece, we have a solid state rod. We have a proper solid state laser, and this will emit light at 1540 nanometers. Okay, in a moment, we'll see the consequence of that. It is for coagulation and non-ablative resurfacing of soft tissue. This is its kind of approval, its regulation. And we use this, originally, this was designed for acne, and you'll see how it treats active acne, but it also does induce remodeling and can treat scars, acne scars, stretch marks, and fantastic for rejuvenation. Okay, so when we talk about rejuvenation, we often talk about a fractional treatment. What does that mean? It means we take the laser light and we pixelate it. We split the beams into micro beams, 7 by 7, 5 by 5, meaning these are gentler beams, and they will laze the skin, but there will be healthy tissue in between those micro beams, meaning that you will have a faster recovery, less downtime. And this really has been, in the last kind of 10 years, the way to go with skin resurfacing. Just a little bit about the history. You know, many years ago, it was all about kind of very ablative, full spot carbon dioxide peeling. And this was very drastic. This was long downtime. This was always kind of a concern for infections and adverse events. And slowly, the whole aesthetic market really realized there was no need for that. You could fraction the beam, pixelate the beam, and you would get a less risky treatment with fantastic results. So this is really, really kind of popular at the moment. So because it's 1540, we have water absorption and we have very deep penetration. So lasers at different wavelengths will penetrate different depths. And this is a deep penetration, making it very, very effective for dermal remodeling. Again, very popular in the last kind of 5 years. These non-ablative fractional resurfacing treatments are fantastic. Lunchtime procedures, improving fine lines, pigmentations, textures, pore size, redness, and like I said, very useful and very effective for scars. We have a cord applicator, so it's a very non-painful treatment, not too much discomfort. And the difference, I promise I'll tell you the difference between the ClearSkin PRO and the ClearSkin. Basically, it's a more fancier, sleeker design with an ergonomic handpiece and button, but most importantly, we have doubled the energy. So it's a very high energy handpiece, making this whole rejuvenation treatment more effective. So what do I mean when I say rejuvenation with this? So for every handpiece, I'm going to just give you one slide of mechanism of action, because like I said, it's important to know what's going on under the skin. So the energy will be transferred, the laser light will be transferred into heat. And this is selective photothermolysis, all based on this theory. And we will reach temperatures higher than 60 degrees inside the skin, meaning we will coagulate proteins, meaning that we will cause these columns of controlled damage. Okay, that's what you see here in purple. This damage will trigger an immune response. Your body will want to repair the damage. You will get a whole host of inflammatory reagents and cells and cytokines and interleukins, and they'll all come towards this area in order to repair it. And this is what we want. We want to replace this by healthier tissue, tighter tissue, collagen that's new and freshly synthesized, and this results in the tightening effect that we want from this kind of treatment. Okay, so how do we carry out such a procedure? And all the procedures and all the protocols are in your quick reference guide, but I am going to give you an example just to show you how to kind of read your quick reference guide. So this is a rejuvenation treatment. We would use a pixel 7x7 tip as opposed to a full beam, which we will get onto later for active acne. We can choose a fluid, anything from 1,000 to 3,000 in our ClearSkin PRO. We use a slow repetition rate, and we stack our pulses over the skin side by side in a stamping method. Position the applicator perpendicular to the skin, and we cover the face, and we can do several passes. Okay, what do we expect to see? Erythema, maybe slight edema if there's slight raising, but everything calms down within an hour. We are not damaging the epidermis in this treatment. Okay, so it's a fantastic rejuvenation treatment and something that the client can go to work the next day, because we are not causing, if we go back to the histology, we see that the epidermis is actually still intact. And this will take about 3 weeks until the whole rejuvenation process, the neocollagenesis comes into play, and we start to see that improvement in the dermal layers. So some clinical results for every handpiece. Here we have before, and here we have, you can see the fading of the crow's feet 4 weeks after 3 treatments. This was a fairly high treatment at 3,000 millijoules per pulse, but it was just 1 pass over the face with 1 pulse. Here again, you can see a fading of some of the lines here around the mouth, the texture, the pores. I mean, we really see a fantastic improvement in the texture and the open pores. Again, 3 treatments, 1 pass, 1 stack. We recently had a webinar on this handpiece because it is slowly becoming our most popular handpiece. And what's nice about it, because it's non-ablative, it can be done throughout the year. Okay, so even in the summer. Obviously, you have to be careful before and after, but it's not a crazy ablative treatment. Okay, a few more pictures just to see this fading of fine lines, improvement in texture and even pigmentation. And here we have an overall kind of glow and improvement again in the skin texture for rejuvenation. Okay, so that's ClearSkin PRO. Let's move on to ClearLift. So ClearLift, I think it's won many awards, really, again, one of our best sellers. And this is a fantastic rejuvenation treatment when using a pixel tip, which I will explain. And it's a Q-switch laser. So we're moving completely now to a different technology. We're going to a 1064 wavelength, and we are using a Q-switch technology, which is a very, very short, high energy pulse. Okay, again, it's quite deep, and this is used for tattoo removal with a full spot. But for rejuvenation, we use a pixel tip, and we can create with these different spacers or a roller, we can create damage or micro, let me just show you here, micro injuries, again, within the dermal layer. Okay, so different to the columns. And this again will induce remodeling and a perfect treatment for skin rejuvenation. So I'm going to go back to the tips just to take you through this. We have full spot tips, and these are for pigmentations and for tattoo removals. Okay, this is a full spot, 1 millimeter up to 5 millimeter, and you can use your Q-switch technology here on this handpiece to effectively remove tattoos or pigmentations. If you want a rejuvenation effect, you would switch to your roller or 5x5, and you would use these colored spacers. So these are depth spacers, which basically they just kind of change the depth of the laser to your skin, meaning you're changing the focal point of your laser, meaning you are changing the focal point of the damage within the skin. So we name these from +2 to -2, and here we can create different levels of injury, which is fantastic, depending on your indication and what you would like to achieve. And I will show you an example of that in a moment. So here you can see we've kind of lased onto a perspex block here, just to show you the different depths here of the photoacoustic micro injuries. Okay, so different depths, all with around kind of, I would say, kind of 2 centimeters up to 4 centimeters going down here. So unique focal depths, controlled micro injuries, and like I said, you can combine these depths, combining meaning that whatever you want to achieve, you change your spacer. And this is really, let me just go back, a non-ablative treatment with minimal side effects, and definitely a lunchtime procedure with almost no downtime, unless you're using the +2, which is quite surface, and again will provide a different kind of effect. So as we know, as we get older, unfortunately, we get an increase in our collagen degradation, a reduction in the amount of collagen that's synthesized, and this eventually results in an increase in skin laxity, folds and wrinkles. Okay, so this is what we want to try and correct. So as I said, we will create these microscopic dermal injuries, and we will denature the collagen. We will introduce a wound. We will get the healing response, and eventually, patient needs patience. We will induce neocollagenesis, and this will all result in a skin tightening effect. Okay, but this time we're talking about photoacoustic. So how do we carry this treatment out? Slightly different to the ClearSkin PRO in terms of we're not stamping on the face, but we're kind of moving gently over the face and firing these pulses. Anyone who has this handpiece knows it's a very, very pleasant treatment. The patient just feels kind of warmth, and we accumulate energy in different areas of the face. For example, we can break down the face into 20 centimeter areas, and we would accumulate about 1,000 joules by maximum fluids, if the patient can take that heat, until we're done. And that's it. You can change tip, you can change depth, and the more treatments, I think, you know, the better the results. Let me just show you some fantastic results with ClearLift. This is from a colleague in Serbia, a doctor in Serbia, who sent me her results of, sorry, I've just covered over my things. I think this is 6 treatments. Yeah, 6 treatments with her ClearLift. And I think this is just fantastic, fantastic results of that rejuvenation. Again, fading of fine lines. And because it's a photoacoustic effect, you need to remember that we're going to really tackle that uneven pigmentation. You're going to get a very nice toning effect. So these, I think, are very impressive results. Another doctor that we work with, here again, this is 3 months after 6 treatments with ClearLift. And just at a first glance, you can see, you know, kind of 10 years, 5 to 10 years kind of off the patient, which is fantastic. We have the roller, which I briefly mentioned, and this is great for large areas such as the neck, where you want to just have a faster treatment. Similar concept, and I can go back to that if anyone wants more details on the roller. Just one more mechanism of action that I wanted to share with you, and that is that when we are treating pigmentations or tattoos, we want to absorb the light, whether it's 1064 or 532. And because of this Q switch effect, we will actually shatter the pigment into tiny, tiny fragments. And then the body, which is why you have to give patients time, will actually clear this pigmentation by itself, by the lymphatic system, by phagocytosis. And there will maybe a crusting, and then a recovery process, which I will show you in a moment because it's important to realize this, and then eventually clearing of the pigment or tattoo. So let's have a look at a treatment of a pigmentation with our KTP tip, for our 532. So we're still on ClearLift, but we're on a full spot now, 3 millimeter or 4 millimeter. This is a very strong handpiece because it has absorbance at 532 nanometers, meaning it's very, very high, but it's very effective. And you just literally laze over your area once until you get a nice frosting. So you always need to carry out a skin test on these kind of treatments. And then eventually I will show you the patient. This is a fantastic slide here that we got from a doctor in India of a woman who wanted to literally kind of clear all her freckles. It was actually before her wedding and she wanted to have a clear face. So every freckle was treated with this 532 Q-switch laser. You can see there was crusting, darkening of the lesions. Eventually they faded and fell off, and there was even a little bit of hyperpigmentation here. But 2 months after the treatment, fantastic, wonderful results for the bride. So that's how we like to treat pigmentation. This can be also carried out on the hands, great for age spots on the hands as well. Can be used on high skin types, but obviously with a skin test and with extra care. And again, after 2 sessions, 2 months, you can see this whole area pigmentation nicely cleared. Okay, moving on to handpiece ClearSkin. Very similar, like I said, to the ClearSkin Pro, but I'm going to just focus now on the acne indication here, which I mentioned earlier. So this will also carry out your rejuvenation. This will also perform your rejuvenation like the ClearSkin Pro, albeit at lower energy. But for acne, active acne, it's very, very effective because of its absorption in water. So it's high absorption in water, if you remember, and its deep penetration. We can actually laze over the lesions. The water within the skin will absorb this laser light. It will heat up, and we will reduce sebum production by literally removing or dehydrating all the area there for the bacteria, for bacterial proliferation, for inflammation. And after several treatments, you will see a reduction in this active acne. Like I said, the inflammation and the production of sebum. We have a great cool tip for comfort. We have a vacuum tip, which also helps to draw the lesion closer to the laser, helps again with any pain sensation, and makes the treatment a more comfortable treatment for the patient. Again, all the details are in your quick reference guide, but we in general work at low fluence. It's a deep penetrating laser, normally 1 pulse or maybe a second pulse, and then we wait a few weeks and then call the patient back for another treatment. And we do see great results with eventual clearing of the acne. And like I said, because it does penetrate deeply, we also get improvement in the acne scars. If there's an area of active acne and scars, we see clearing, and we also see remodeling and fading of the scars because of this mid-infrared laser. Okay, and again from Dr. Ganesh Pai in India, who sends us lots of his results with these lasers, fantastic results here of acne, and you can see the whole area even around this acne, including the scarring. Okay, so we're going to move on to our third laser, and this is, again, it's a 1064 nanometer laser. However, we are no longer using a Q-switch technique here. We are increasing the pulse width, and we call this a long pulse. So long pulse 1064 technology is really indicated for the treatment of vascular lesions. So port wine stains, as you can see, cherry hemangiomas, spider angiomas, spider veins, telangiectasias, All these are great indications for this laser. A very powerful laser, and again, a laser that, like all lasers, need to be used with caution. Mechanism of action for our long pulse is, again, heating, but this time we want to heat within the vessels. We want absorbance by hemoglobin and water. So let's remind ourselves, 1064, which is an ND YAG laser, has high absorption in melanin, which we have to be, which is our competing chromophore, but also in hemoglobin and water. And this is what we want. We want heating of the blood within the vessel that's going to result in this coagulation and this gluey-like plug that will shut off these capillaries that we want to clear. So it's important, you know, again, it's a bit of an art. Skin test, you need to kind of maybe read a bit more about this, and there are doctors that have years of experience of treating these kind of vessels. But it's important just to note that you need to examine the patient. You need to see estimate the diameter of these vessels, and we don't treat anything that is really that is deep or anything larger than a 4 millimeter diameter. But these can be treated very successfully. In terms of methodology, it's a one pulse with gaps, because we use a 6 millimeter spot size, which is not visible to the eye. So we recommend 1 centimeter gaps. And again, according to the amount of blood you can see, the color, blue, red, spider, face, body, you need to judge on your fluence and your pulse width. Fluence, if there's lots of chromophore there, you can lower your fluence. Pulse width, if you have a bigger vein, you need more heat. You need your laser to have an exposure time to the indication for longer in order to be effective. Okay, so it's a way up of lots of parameters in order to shut down these vessels. But a very effective treatment on leg veins, especially, like I said, you know, pulsing with 1 centimeter gaps, and almost end point is normally it's not a pleasant procedure. You know, ice can be used, cold ice packs after the treatment, a Zimmer air blower, and then sometimes you see there's a raising of the veins, and then eventually, or sometimes almost instantaneously, there will be a disappearance. Here we have a doctor that sent us a picture of the venous lake, which again cleared very nicely here. Bit more cautious to do it on the face, but many doctors are happy to use this on the face for some of these telangiectasias. And here, I think this is this is a leg again after 10 days. Okay, so that's our vascular handpiece. And the final laser is the Erbium YAG 2940 nanometer laser. And this is your ablative laser on your whole Harmony platform. And I think, you know, any clinic that's going to do serious kind of dramatic treatments would need an ablative laser. So not only is this for rejuvenation, but this is for cutting. I mean, this can remove skin tags, this can remove cysts, this can remove benign lesions, because it will evaporate off the skin. But that's also fantastic for a very kind of superficial peeling. So how does this work? As I mentioned, very, very high absorbance in water, meaning we laze onto the skin. You can see in this histology here, and you know, whoosh, you get kind of ablation of part of the skin, which is really fantastic for pigmentations, like I said, peeling, and it's fairly surface. Okay, so it's not as deep, but again, depending on what you're trying to achieve. And when we go into the combinations, you'll see how this can really complement other lasers. So I'm going to just divide this into resurfacing and rejuvenation and cutting and removal of skin tags. If we use the fractional tip again, we will create these columns, micro columns, as I spoke about. But this time we're creating ablative columns, so channels. And eventually, again, with the healthy skin in between these columns, we will stimulate the body's natural wound healing response, and we will eventually repair these columns. And this is great for skin texture, wrinkles, pigmentations, scars. Lots of doctors like to use this for scars and stretch marks. Okay, we will also get a degree of thermal effect, like I mentioned before, but much less. Okay, all the energy goes, most of the energy goes into ablating the tissue. So if we're doing a fractional protocol, this will have a little bit more downtime in the ClearSkin and the ClearLift, because as you can see here, we are creating these little micro ablative spots. You would need to use a smoke evacuator and a facial mask. Well, that's ABC these days. And again, various protocols depending on the degree of ablation you want. Okay, you could have a very, very gentle treatment with downtime of kind of 1 to 2 days, and then you can go a bit more dramatic or a bit more aggressive, and the downtime will be longer, but eventually the results will probably be better. So here is again a nice picture we've got here from a doctor here that we saw for rejuvenation or resurfacing. So you can see there's fading of fine lines, the pores look better, even laxity has improved here. This is one of kind of my favorites. This is, if you look at this to here, which is a few months later, it's just amazing. I mean, the fine lines, the pigmentations, and this is a Erbium YAG resurfacing treatment by one of our KOLs, Professor Lapidot. Another one here, just to show you, maybe it's always important, you know, that the patient, again, expectations, what to expect in the meantime. And as I mentioned, Erbium YAG, you know, there will be some downtime, there'll be pixels, there'll be frosting, but it calms down within 24 hours. And again, as long as it's maintained after kind of a week or so, the patient shouldn't see too much, but the results can be quite impressive. And again, because of its minimal absorption in melanin, it can be used on higher skin types. We always advise a skin test. There should always be some caution here. There's always a risk of PIH when you're using post-inflammatory hyperpigmentation, and one needs to always be careful when choosing, when treating darker patients. And again, crow's feet, if there's an intensive treatment around the eye area, I think this is a great laser to treat that. Another good rejuvenation from, or resurfacing, I would say, with the Erbium YAG from Dr. Ganesh Pai. And for the benign lesions, we use a focus tip. So we're no longer on fractional, and we can choose a 1 millimeter or 4 millimeter. And again, this is literally, you know, ablating the tissue. So we can either, we can remove, let me just show you by the pictures, we can work over a raised area, for example, of this kind of lesion, which is a great result here again. After 10 days here, you can see this, there's already a little bit of hyperpigmentation here, but here it starts to come back and clearing of this lesion. We can use this handpiece for keratosis, it's for any kind of raised lesion by shaving this down. I mean, it's just completely disappeared here. And again, like I said, keratosis, this would definitely be my laser of choice. And if we want to remove a skin tag, then we could use a 1 millimeter spot size, and, you know, being careful with being careful to kind of lift this up and to work on the stem area and to remove the skin tag. Okay, so this is an ablative laser. Anyone who's familiar with that knows what can be achieved with that. Okay, so I've finished the lasers. I'm going to talk about just 2 more modules, and then I'm going to finish with the combinations and the tips that I promised you. So AFT is Alma's way of saying a very efficient and very effective and safe intense pulse light. There are many intense pulse light technologies on the market, and Alma does pride herself on having one that is quite sophisticated, that uses any unused light. So we work with filters and using that light to pour back into the handpiece. And basically this results in a safer treatment, okay, a safer treatment, a more efficient treatment. You don't have to pump up the energy so high to get a good result. We get great clinical results, and it's also delivered in a uniform, if you just look at this blue block here, a uniform and safe delivery. We don't have any of these spikes that you can see in some of the other IPLs available. So, so that's just a little bit about Alma's IPLs. We have several IPLs, but I'm only going to talk to you about the DiVL, as I mentioned. And another aspect of Alma's IPLs is that you can also work in motion. So those of you that were in my Soprano webinar know exactly what I'm talking about, but you can move the handpiece and you can accumulate energy. So it's a more comfortable procedure, a safer procedure, and has great results, okay? And when we get to that, I'll show you exactly what I mean. But there are 2 modes of working with our IPLs. So the DiVL is intended for pigmentations and vascular lesions. You can only work until skin type 4, and this is because of the very high absorbance, as you can see, in melanin and hemoglobin. So our spectrum is a narrow spectrum, again, making it very effective. We don't just have one filter that just kind of goes from 500 to 1,000. We've really narrowed it down to 500 to 600 nanometers, and we can target, as I said, hemoglobin and melanin. Because of melanin, that's why we don't go to high skin types. And we have a cool tip for comfort. It's a fairly large tip and can be used in a stationary fashion or in motion. Mechanism of action here is, again, photothermal. The energy will be converted into heat, and it will destroy the melanocytes or in the pigment and result in lightening, and also be absorbed by hemoglobin and treating any vascular lesions. Okay, you need to remember when using such wavelengths that the penetration is fairly superficial. Okay, so that's important to remember. How do we treat? So if we're looking at in motion or DI-SVL, then we choose an area, so around 100 centimeters squared, say a cheek. We would choose effluence depending on skin type, and we would work in an in-motion fashion going over the area. Okay, so it's kind of, it's flashes because we're talking about IPL, the correct eyewear needs to be, protective eyewear needs to be worn, and we accumulate energy. It's a gentle treatment and it works fantastic for the face, for the décolleté area, and for the hands. If there's an area of photo-damaged skin with many sunspots or age spots, this is a great treatment and a very popular treatment. You can also use this in a more kind of stronger fashion by stamping it onto the face or onto the hands, and here, or just treating a single lesion. So we have stencils that will just block out the rest of the light, and you will just be targeting that superficial pigmentation. And it's great for large areas on the face. Here we have a vascular indication that can be treated after several treatments with our DiVL. Another vascular lesion here. So I'm not sure if this was a stationary or an in motion, but it doesn't matter because it will target and it will clear this area. Again, here's nice, you can see the pigmentations and the vascular lesions. As I mentioned, hands can also be treated very effectively. and the décolleté area. Fantastic treatment, very popular treatment, especially in sunny countries where this is a very common condition. Some doctors also like to use the DIVL again as a kind of glowing rejuvenation treatment. So as well as, because it kind of evens out your skin tone, it gives you that glow effect. It will give you a uniform effect over the face. And as I mentioned, very popular for that. It could also be used to treat scars. You know, if there's any red or vascular element to a scar before going in with your Erbium YAG, you could treat it with DIVL. Some doctors even like to use this handpiece for treating acne, again, because of its absorption in hemoglobin. And I just wanted to mention the DISR, because this is a kind of a safer version. This is the version that we sell in countries that treat higher skin types, because with this one, we've kind of tweaked the spectrum, and you can go up to skin type 5 here. So that's just something to note. We have one peak of absorption here, and we've gone down a bit in the scale in terms of melanin absorption, making this more suitable for higher skin types. And like I said, using a stencil, we can burst this with some energy of DIVL or DISR in this case. We would get darkening, scabbing, and then disappearance. Okay, so for my final handpiece, I'm going to just give you a few words about the very popular near-infrared handpiece, which is used for skin laxity and really creates deep dermal heating. It is a handpiece that's also used for an immediate glow, an immediate lift. Very popular. We have doctors that use this for models, for you know, kind of before kind of going off on the catwalk, for this kind of Cinderella effect, which the near infrared does create. It also creates a long-term effect. It works by having a large spectrum, a deep penetration, and so subdermal heating, and as I said, an immediate skin tightening and glow, and also creating that kind of damage to collagen for eventual neocollagenesis. So it peaks at around 1,300 nanometers, high absorption in water, and like I said, we can shrink the old collagen and get this deep tissue heating. A very, very, again, popular handpiece for rejuvenation. And we work again in motion, and we accumulate energy within a certain grid. Okay, so let's, I think, swiftly now move on to combinations. So how would you use these handpieces together? So I've just briefly gone through some of the combinations that you could use, and just explaining why I would put these two together, and ending in just something a bit more relevant to COVID times. Okay, so why combine? I think that's kind of obvious, just different mechanisms of action for those of you that are still listening, for better results. If we tackle a problem with different tools in a different way, then we can be more effective. And because you have it on one platform, you know, why not use all the tools you have? Okay, so ClearLift and ClearSkin has always been a very popular combo for doctors around the world who have the Harmony XL Pro. And this really offers a very pleasant, very little downtime treatment for tone, texture, fine lines, and it uses the ClearLift photoacoustic effect that I explained to you, together with these thermal columns and this photothermal effect. So we have a heating effect, we have a photoacoustic effect, and together we're really inducing as much kind of controlled dermal damage, but with this repair that will eventually result in dermal remodeling. Okay, so just to show you that we're tackling this at all different depths and different mechanisms of action. And don't forget the ClearLift, because of its wavelength, will also add that toning effect, okay, because for pigmentations. Protocols for this, again, something I can send to Adam, but this is normally a gentle protocol. We've given you a timeline as a suggestion here, but it's up to you how you combine these. They can even be combined in the same session. You can have same session, you can have a week apart, and it can go on for, you know, for a couple of months to really boost up that whole effect. Here again, we have a combined treatment. I think this might have even been the patient we saw before, but because of the redness here, together with the scarring, this doctor here has combined ClearLift and ClearSkin. Another patient for rejuvenation, 3 treatments, combining and seeing a total rejuvenation. Okay, so I promised you something about COVID days, and we've recently published a white paper together with a doctor called Frach in Italy, cosmetic surgeon, who has come up with a way of treating the now popular acne, which is kind of the acne where people thought they were well over that is now popping up because of the continued wearing of masks. And I think we're all suffering with that, with dryness, with pimples popping up. And this is where, again, ClearSkin PRO, ClearLift can be fantastic for this. Reduces the inflammation, we'd use low settings because the mask does have to go back on the next day, but we can reduce that redness, that inflammation, and tackle those acne pimples that are coming up because of the trapped moisture and the conditions there under the mask. And here are some of her very impressive results of what she's seen with patients with acne, with these acne lesions around the lower part of the face, and fantastic improvement after a couple of treatments with ClearLift and ClearSkin. So a very gentle treatment, and I will send Adam the white paper that he can share with you, the details of how to treat with this. Okay, so Nia and ClearSkin PRO, both rejuvenation, bulk heating here together with these columns. This is something for, as an anti-aging, I would use a fantastic treatment. Again, hardly any downtime. You could start off with a Nia treatment and then give the patient maybe half an hour for the skin to calm down, and then go in with the ClearSkin on the same session would not be a problem. Same with Nia and ClearLift. Again, ClearLift can always be combined with Nia for heating and photoacoustic. So you can see different mechanisms of action, all for the same, the ultimate effect. And here I would probably do ClearLift 5x5 rejuvenation treatment, allow the patient some time again for the skin to calm down, and then do a nice Nia accumulative energy treatment after that. IVL, as I mentioned, very good for rosacea, targeting melanin and hemoglobin, but also, again, together with acne scarring or rosacea or open pores, can be used together with ClearSkin PRO. Probably DIVL first, followed by the stamping of ClearSkin PRO, which is slightly more downtime. So I would end with the ClearSkin PRO. And as I mentioned before, an ablative and non-ablative treatment together, fractional, is again a very popular combination. So using these ClearSkin PRO for your non-ablative fractional remodeling, but then going in afterwards with Erbium YAG for pigmentations, again for this kind of skin resurfacing, is a fantastic combination. Okay, suggested protocols, they're in the guide, and this presentation will also get shared. Suggested timelines, I mean, these are just suggestions, but it's something you could incorporate into a program for a particular patient and start off with a pro, going with a more aggressive a week later, Erbium YAG, and again, kind of going in with both of them. For certain vascular lesions, I would also combine DIVL with long pulse. If there is a tricky vascular lesion with different depths and different diameters, your 1064 will be able to penetrate deeper, and your DIVL could tackle more surface vascular lesions. So again, a very popular combination for doctors that treat vascular lesions. And finally, just to let you know that there really is no end to the variety of things you can do with your Harmony Pro, and that is even 3 applicators. So just as a kind of few suggestions, to whet your appetite, you could use ClearSkin PRO, ClearLift, put in near infrared, okay, for a kind of month-and-a-half rejuvenation program. And depending if you want to maybe give a particular focus to tightening or toning or texture, then I'm sure now that you're clear on all the technologies and all the mechanisms of action, you would know which handpiece to choose, but we're always here to help you. And I think that is probably more than enough for a lunchtime lockdown webinar. I really, like I said, flexibility and freedom is really the name of the game with Harmony. And I hope you guys enjoyed, and I will be happy to answer any questions that pop up in the chat box. Thank you. Okay, so Adam, are you with us to help me help me go to our chat box? Okay, here we are, chat. Okay. Okay, like I said, I will send this presentation, so it was recorded and it will be available. It will be available for all of you. Adam has left his details here. And okay, so I have the first question here. Why would you use ClearLift KTP as opposed to the IPL? Okay, now that's a great question. They both have kind of similar spectrum wavelength, 532 and 500 to 600. The answer is you could use both. Okay, KTP is more, you will probably have to be more cautious for higher skin types, but again, using low settings and making sure you just treat the lesion, it's fine. Different mechanisms of action. One is a photoacoustic. I think if I had small pigmentations on the face or hands, I would maybe go in with KTP and leave it. If I had a larger area of many kind of pigmentations, I would probably use the IPL. But they could, they both could be used. Okay. I'm not sure of this one. How often would you repeat ClearLift KTP to target pigmentation? Okay, in my experience, to treat a pigmentation with KTP, very often one treatment is enough. Okay, which is why I like it. The patient needs to be aware that there'll be crusting, that it's fairly aggressive, and I wouldn't maybe do it, like I said, on very high skin types. But one treatment is often enough. If not, then I guess 2 after a big interval, after a longer interval. I had ClearSkin done for my acne, and I think it's an amazing treatment. Wow, that's really nice to hear and encouraging. Okay, there's an interesting question here for lifting eyelids, and I have seen ClearLift being used around the eyelids. I've seen it being used under the eyes for dark circles. I've seen it being used above the eyelids, and I almost see an immediate effect. There are also doctors who use ClearLift for lip rejuvenation. Okay, so there are ClearLift is you know, doctors have really taken it and run with that and devised protocols for that. So eye pixel protocols, what would you advise for stretch marks, reddish? Okay, so again, you could combine red stretch marks again with something like DIVL, and then go on with the Erbium YAG. The roller is very good for stretch marks. It's quite aggressive. The roller has more energy because it has less pixels. It's 7 pixels as opposed to 49, so you're getting a more ablative, aggressive treatment, and a few passes over the stretch mark, maybe some topical anesthetic first, and that's something, again, you could go with. You could go with a longer pulse width to induce a bit more of a thermal effect to maybe help with the remodeling and not just the ablation of the stretch mark. Oh, I need to unmute. Hold on.
I'm back.
Until I got to your question.
I was trying to wave and all sorts. I don't know what to do. I was going to help you with the questions here.
Oh, thanks. Okay, we're up to blisters for tattoo removal. Is it normal for patients? Yeah, I didn't go into tattoo removal because there was just so much there. But yes, you know, tattoo patients, for tattoo removal, you can get blistering after, and that is normal. And as long as the patient keeps the wound clean and no infections, we do try to start on low parameters and go up to the fluents where we just see frosting, especially if they're very black. You don't need to go too high with your fluents. And, you know, again, we try to avoid pinpoint bleeding, but it does happen, and the patient needs to be aware.
Another one we've got is the soprano NIR same as harmony?
Yes, it's the same mechanism of action. There may be changes in terms of the model and design. I'm not entirely sure of that, but in terms of mechanism of action, it's exactly the same. Yeah.
Okay, next question is from Maria at Pulse Laser. Hey Maria, for acne scarring, would Pixel give better results than ClearSkin or a combination of both?
Okay, so I think for scarring, I wouldn't go with a full spot. You can, it's more aggressive, there's more risk involved. And if it's an area, even if it's a small area, I would rather use a pixel tip and do several passes than going with a full spot. The full spot, you know, you have to work at lower fluence, you have to be careful, you don't want to blister. You know, I have seen doctors go too high with the full spot. So I think for treating individual lesions for active acne, it's fine. If I had an area of scarring, I would probably go high with my pixel.
Okay. Next question is from Margaret. It's the old ClearSkin also good for rejuvenation treatment, or is it only with the newer version?
Yeah, I knew somebody would ask that question, and that's a great question. Yes, you can definitely carry out rejuvenation with your old ClearSkin. The maximum you would have on your old ClearSkin is 1,500 millijoules per pulse, and that's fine. Just keep going over and keep accumulating energy. I just spoke last week to a doctor who hasn't upgraded, and he still gets fantastic results for rejuvenation with his old ClearSkin. Just deliver lots of energy or more passes. He kind of goes in, I think, quite aggressively with like 4 or 5 passes, but that's fine. If the patient can tolerate it, maybe some EMLA, then you can do 4 or 5 passes and use your old ClearSkin. Yeah.
Okay. Thank you. Next question from Carolina. Before they were told to use AFT handpieces, on skin type 1 to 3. So is it safe to use on type 4?
For the dye SR handpiece, let me just check. I think that is safe. Yes, I think that is safe until skin type 4. That's been approved for skin type 4 in the quick reference guide. And again, something that I can double check in the operating manual. But as far as I remember, the dye SR is safe for that, not the dye VL that I explained.
Yeah, and also just to add to that, there in UK, the insurance companies got a little bit funny with AFT, IPL versions. So just to double check with them, because a lot of the insurance companies would only insure up to 1 to 3. Hence, we have to have something slightly different. Sometimes in UK, we have to conform with the insurance companies.
Okay. Yep. So no, I'm all for playing it safe as well. Always playing it safe. It's a very strong handpiece, the AFTs. They're very strong.
Indeed. Another question from Natalia. Can you treat melasma with the skin rejuvenation gun?
What do you think she means by skin rejuvenation gun?
I'm thinking she's SR handpiece, AFT.
Oh, okay, AFT. I have seen some doctors use melasma with a AFT. I don't have that much experience with melasma, but I think I would maybe try our ClearLift, maybe our Pixel ClearLift for as one of the many modules that you can use to treat melasma. Yeah, I thought again maybe she meant ClearLift, and that is something that I have seen doctors use. Again, combination with creams, but the ClearLift fractional, so the pixelated, can be used to treat melasma because of its depth as well, 1064. Probably not the AFTs.
Okay, I think that's all the questions so far. If there's any more, please let us know, everybody.
So the presentation will be available, and it's a lot to take in, I think, in one webinar, but maybe going through that, there might pop up some more questions or more or any more clinical help that you guys need.
Yeah, just to add, if anyone wants the presentation recorded version, please let me know. All my details are in the chat. And also just to say that I know a lot of us heard Sharon refer to doctors a lot, because as we know across the pond, many clinics have to be doctors and nurses, but that does refer to us as therapists, business owners, anyone who's qualified and insured in the UK. So don't panic, because I'll get loads of messages now, Sharon, say, oops, I'm not a doctor, what have I done? So but that's just to let everyone that treats is a doctor. Exactly. So everyone's covered on that. So yeah, thank you very much, Sharon, again, really appreciate it. It's been absolutely amazing, very informative. The last webinar, everyone was raving about it, and I doubt they will about this one. So we hope to see you soon. And if anyone wants any details, please contact me direct. Thank you very much, Sharon, and we will catch up soon.
You're welcome. You're welcome, guys. Stay safe.
Take care, guys. Thank you. Bye-bye.